Ever wonder what really happens when you go under for surgery? Well, there's a very good chance your trip into unconsciousness starts with this little white liquid. It's an absolute cornerstone of modern medicine, but it's also pretty misunderstood. So today, we're going to pull back the curtain on the anesthesia known as propofol.
In operating rooms and ICUs all over the world, medical staff have a nickname for it: the milk of amnesia. It's a pretty wild name, right? But it perfectly captures both its strange, milky look and its incredible power over our memory and consciousness.
So what is it officially? Well, propofol is a really potent intravenous drug that basically puts the central nervous system on pause. And that nickname makes perfect sense when you see how it's made. It's actually an oil and water emulsion. Think soybean oil and egg lecithin. That's what gives it that signature milky white color. So how does a liquid do that? How does it safely and, more importantly, quickly make a patient unconscious? The magic is all in how it messes with our brain chemistry. It's basically like finding the master off switch for the brain and just flipping it. The main player in this whole operation is a neurotransmitter called GABA. Now, you can think of GABA as the brain's main brake pedal. Its whole job is to slow down and calm nerve activity. Propofol is clever. It doesn't invent a new system. It just finds that GABA brake pedal and slams it to the floor. Let's get a little nerdy for a second and see how that works. First, propofol latches onto a specific spot called the GABA-A receptor. This makes that receptor way more sensitive to any GABA that's floating around. The receptor's channel then opens wide, letting a flood of negative chloride ions rush into the neuron. All that negative charge makes it impossible for the neuron to fire. Now multiply that by millions and millions of neurons, and voila, you get deep sedation and unconsciousness. Okay, one of the most incredible things about propofol is its speed. We're talking less than a minute from the time it hits your vein to the time you're out. But what's just as amazing is how quickly it wears off. A single dose is gone in about 5 to 10 minutes. I mean, this rapid on-off switch didn't just make anesthesia better. It basically created the whole field of outpatient or day surgery. It's a total game changer. So what's its secret? How is it so fast? It all comes down to its chemical makeup. Propofol is super fat-soluble, and that property lets it slip through the fatty shield protecting our brain, the blood-brain barrier, almost instantly. Then, just as quickly, it gets pulled into other body tissues like your muscles and fat, which is why its effect on the brain is so short and so easy to control. And it's that precise control that makes propofol just an absolutely essential tool in the modern medical toolbox. So, let's take a look at where this powerful drug gets put to work every single day. Its resume is incredible, really. It's used to put people under for major surgeries, and you can run it as a continuous drip to keep them under. For smaller procedures, like a colonoscopy, lower doses give you what we call conscious sedation. And it's a workhorse in the ICU, keeping critically ill patients comfortable while they're on a ventilator. To give you a sense of the precision we're talking about, a typical dose to put an adult to sleep is somewhere between 1.5 and 2.5 milligrams for every kilogram of their body weight. But, and this is a big but, this is not a one-size-fits-all kind of thing. Dosing is a delicate art, carefully tailored to every single patient's age, their weight, and their overall health. And that leads us to maybe the most critical point of all. A tool this powerful absolutely has to be in the hands of a skilled user. Propofol can only be given by trained professionals, like anesthesiologists who know exactly how to manage a patient's breathing and their cardiovascular system if things start to go sideways. Because like any powerful tool, it comes with a pretty detailed instruction manual and some very, very serious warnings. So let's take an honest look at the potential side effects. All right, looking at the common stuff, the biggest one is hypotension. That's a drop in blood pressure. It also depresses your drive to breathe, which can sometimes even make you stop breathing altogether. That's called apnea. And yeah, for a lot of people, it can burn a bit going in. So here we have it broken down by system. The effects on the heart and the lungs are totally dose-dependent. The more drug you give, the stronger the effect. These are the main reasons why constant hawk-like monitoring is just non-negotiable whenever propofol is in the picture. But you know, it's not all bad news on the side effect front. There's actually a pretty cool silver lining. Unlike a lot of other anesthetics that can make you feel sick afterward, propofol actually helps prevent nausea and vomiting. That antiemetic property is a huge bonus, and it makes recovery a lot more pleasant for a ton of patients. Okay, so there's another risk that has nothing to do with how your body reacts to the drug and everything to do with the liquid itself. Remember that oil and water emulsion? Well, that rich, fatty mixture is basically a five-star hotel for bacteria if it gets contaminated. And because of that risk, the rules for handling it are incredibly strict. Sterile technique is mandatory, no excuses. Once you pop open a vial, it has to be used and thrown out within a few hours. That's the only way to eliminate the risk of pumping a dangerous infection right into a patient's bloodstream. But there is one risk that stands in a class all by itself. It is the ultimate warning label on the box. It's a rare but truly devastating complication called Propofol infusion syndrome, or PIS. And I really want to pause here for a second. Let's be crystal clear. This is not a common side effect. It is an extremely rare event, but it is so severe that when it happens, it is very often fatal. PRIS is what happens when this incredible tool fails in the most catastrophic way you can imagine. It's usually associated with long-term, high-dose infusions, the kind you might see in an ICU to sedate a critically ill patient for days on end. The current thinking is that it basically causes the body's cells to fail at a microscopic level, so they just can't produce energy anymore. And the results are just devastating. The blood turns highly acidic, muscles literally start to break down, potassium levels in the blood spike to dangerous levels, the kidneys fail, and then ultimately the entire cardiovascular system just collapses. It is a complete multi-system failure that is incredibly difficult to come back from. So, after going through how it works, what it's used for, and the risks, how should we really think about Propofol? I think the most accurate way is to see it as a double-edged scalpel. It is exceptionally useful, but it is also inherently dangerous. And this slide really lays that duality out perfectly. On one side, you have a miracle of medicine. It's rapid, it's controllable, it's versatile, it's essential. But on the other side, you have a powerful risk, profound side effects, the absolute need for an expert's hand, and that rare but fatal shadow of PRIS. This is the high-stakes world of anesthesia. In the end, Propofol is a precision tool that has made modern surgery possible and has saved countless lives. But its safety relies completely on the training, the vigilance, and the judgment of the person giving it. And that leaves us with one final, pretty sobering question. It might be a precision tool, but what happens when the user is only human?